role model type, but and they can have some influence, but it's really that parent that has, I think, the strongest impact. Of the persons that you guys were able to survey and the like, were you able to get a lot from parents or from grandparents or from?
The majority of the people who completed the PACE survey were parents, and they were also middle-aged people. We found that also the majority of the people that completed it, or the majority of the people that completed it, one, they all had to be from the Midtown area, but the majority of them either had been there for an extremely long time, most of their lives, or just moved there. So it was.
So there was no midpoint. You either had been there pretty much all of your life, or you just moved there.
For the most part. For the most part. And the question you were asking earlier for PACE is the same as Achieve. It's a specific area for this PACE project, and it's actually a much larger area than other projects. Although there is a PACE project on the west side of the county, in De Leon Springs area.
Oh, okay, okay.
Which that has been around a little bit longer, and they're kind of closing down, which is entirely different area, entirely different issues. But like Dr. Phillip was just saying, I think that it's really important for listeners to know, I guess, in regards to all of these issues, is that these huge issues don't just like develop overnight. You know, when you look at like the family unit, like Dr. Phillip was saying, that came up in every discussion at the steering committee meeting. They were like, well, you know, it all comes back down to this. You know, unemployment and crime and drugs and all these different things. They're huge issues now, and it is something that has to be addressed. But you know, one of the things that we want to look at is what can we do to prevent that from an issue later on? Because what we don't want to do is treat the symptoms, and then never get down to the actual issue. Because if we're able to fix everything now, then the next generation, we're kind of back in the same boat. So we really want. I think that is the focus, the root cause.
And I think as the snapshots that have been taken by One Voice for Pollution and the like, they found similar issues in terms of the demographics and the stats as it relates to 32114. And I know that one of the issues they've looked at too, and maybe that's part of what you guys are looking at, or may have come up in discussion as well, and that's a lot of these are single parent households where for the most part there's no male. Did you find a lot of that?
Well, unfortunately our assessment has a strong female bias, and that has to do with the times and the places that were actually surveyed. 73% female, and the rest were male who were surveyed. So we really can't speak to that as far as the ratio, but we do know that it is very large, single parent homes.
Yeah, and given that, and my hat's off to single parents raising children. I applaud them in terms of what they do and what they're able to do. But in terms of having a male in the household, we're not talking just have any male in the household. We're talking about a male that actually does provide some productive input, positive input in the life of the children. And sometimes a pastor takes that place of that. Sometimes there are others in terms of mentoring programs and the like. I'm just wondering in terms of, and I know in the snapshot they were looking at single parent households and the lack of a male influence in the household. Is that something that is a part of anything you guys are looking at? Is it something that may be coming up in the future? Is it something that any of the pastors are talking about, whatever?
Well, I think interestingly, single heads of household are becoming more common.
Not when you look at the census, yeah.
Yes.
And not just African American families, but
exactly. It's
throughout.
It's county-wide. It's population-wide. There's not that incentive to get married. If there is a marriage, oftentimes it's late in life. Children are being born to women later in life, and that's sort of a symptom of our society. And then, how do we address that? It's one thing to have a single, female head of household, but where is the male? What is that? Child support is one thing, but what about that male figure? What about that empowerment? And a lot of what we do in our HIV program is to, we have a term called man up.
Yeah.
It's like, hey, you have these children, they are your responsibility, you're the parent as well. Man up to your responsibilities. Because the men kind of get off easy sometimes, you know, in many of, and increasingly in our society.
Yeah.
So it's sort of a undertone, I think, issue that we're not going to obviously change morality and change that normality in our society, but we can look at, well, what can we do to assist children who need that influence.
Right, that kind of male influence in their life, you know, that kind of, and it be a positive impact, because, you know, you can have somebody there that's not going to man up or whatever.
Absolutely.
And, you know, that's not to take anything away from the mothers that are raising the children. They're doing fantastic jobs, and they should keep doing it. But especially if there's a male in the house, they do need a positive male influence. And so that's why we say that in our schools we need male teachers. And that's why we say that in many of the settings where the only thing children are exposed to, again, not taking anything from women, I'm a woman too, okay? But in a lot of these settings we need both male and female role models, because the young men need to know that they can accomplish things, the young women need to know that they can accomplish things, that it's not a matter of your sex or anything else, but you can be the best you can be, whatever that is, and, you know, they need role models that will show that and demonstrate that and actually deliver that message. In terms of pace, in terms of achieve, in terms of all the great and wonderful things that the health department is doing. And you guys do so much, you know, so much that people don't even know about it. Of course, Stephanie, she's always sending out these press releases telling people but all the awesome things that are going on, you know, and I get them, and I try to share as much of it as I can, but there is just so much that is going on in terms of our community, in terms of health issues, in terms of, as you said, there's only a certain percentage that the health department and the healthcare system can impact, and so much of a larger percentage is based on us, how we live, you know, are we active, do we exercise, how do we eat, you know, and whatever.
One of the other initiatives that we have going in the community that's really a countywide initiative is called Let's Move Volusia's Youth. Our focus is really on trying to prevent chronic diseases, trying to prevent people from getting sick and needing to access our disease care system. And obesity, particularly in our youth, is sort of driving this chronic medical, I call them now slow motion diseases. Obesity causes diabetes, it can cause heart disease, it can cause strokes at much younger ages than we have seen in the past. And we actually started this initiative by request of the hospital systems. The hospital systems, wanting to give back to the community and improve the health of our community, said we want to do something together to try to positively influence our health of our community. And we brainstormed about it and said, well, really it's the obesity epidemic that's going to kill the healthcare system, overwhelm the healthcare system, as well as cause a lack of quality of life and early death in the upcoming generation. So we centered on youth obesity, and for that reason we also recruited Dr. Peg Smith, the superintendent of the schools. So we have sort of a joint project focusing on obesity in the youth. We also looked at the obesity in our schools, and it turns out that the most disadvantaged schools are also the most obese schools. So we're hoping to leverage the partnerships, the many community members that are working on either physical activity or nutrition in some way or other, to try to leverage resources, especially the private sector. The private sector is looking for causes to jump onto, and if we can identify evidence-based, kind of factual things that work, that provide a return on investment in communities to address the obesity of the youth, that will help us in the long run as well.
And we also, we don't, not just when they get into school, but we want to talk about the infants too, because I keep saying on this program that baby that's so fat, you know, and you almost feel sorry for them. She's not cute. He's not cute being fat, you know, or overweight, you know. Parent, grandparent, help that child, you know, get with the health department or somebody else to help that child to reduce their weight, because it starts there many times, and then they end up being, you know, fat little kids, and then fat, and I'm not, you know, putting down, because some people have weight issues, okay? But if you start them that way and you don't work with them, you know, to deal with that issue when they're infants and small, you know, and you think, oh, she's so cute, and she's sitting there, she's overweight, that child is in misery, that baby is in misery, and you're doing a disservice to them. So I'm just saying, get with your health professionals, and if your baby's overweight, have them work with you to help that baby to deal with that issue. Because isn't that important? I mean, if, you know, they're not cute, are they?
Well, I don't know if
She's
they're
looking
not cute,
She's
but
looking at, no,
but I
you
would
might want to say they're cute, but no, they're not cute, because they're not healthy. If they're not healthy, they're not cute. Why do you have a fat baby? They're looking at you like you have.
Not that I know of. No.
Oh goodness.
I think they're looking at me because they know what I'm going to say.
Okay.
One of the, Dr. Sorensen just mentioned evidence-based practices. One of the most important things that you can do for an infant as a mother is to breastfeed. And normally we've thought about breastfeeding in terms of reducing infection, which it does. But we've also found that it reduces the risk for obesity, for diabetes, and not just during infancy, but we're talking now into childhood. So one of the major pushes that we have for promoting health amongst kids is to get moms to breastfeed within the first hour of life, ideally, throughout the hospital stay, definitely through the first few months of life. Normally when moms have to go back to work, there's some challenges there. But we...
Oh, they can bottle it up and all that kind of stuff, right?
Well, absolutely. So
right.
There is now a federal law that employers of a certain, I believe it's over 50 employees, are required to provide a space and breaks for moms to go pump their milk, which they can then store, and it can be given to the baby by the caregiver. And this is something that we know it's very important for public health in general when you're looking at a population, but really for those families, it's something. It's I don't want to say it's easy, because I know people have struggled, but as our role is to provide support for those moms, and that's what we're attempting to do with education and classes, and then once they go back to work, as I mentioned, having that support in place for them to be able to continue to do that. And at the health department, we actually have a policy that moms who are exclusively breastfeeding can bring their babies to work for the first 6 months. So I'm not saying everyone go out and do that, but that's how important it really is.
Oh yes.
And so I was just smiling when you were talking about these cute chubby babies. Probably a lot of them are being fed formula, and that's something that we're trying to address.
And sometimes the parents are trying to fast feed them to the point where they're even skipping some steps and feeding them something they should not be feeding them before they're ready. Sometimes, and that happens as well. And all we're saying is, it starts with it actually starts when they're in the womb, right?
Oh, absolutely.
With that mother actually eating appropriately, and not, going and going on some kind of a, like I did the other night, where I ate half a gallon of yogurt ice cream, but that was one of those child choice things, I think, which I paid for all night long. But anyway, yeah, that was one of those elements. Reward yourself and then pay for it later type thing. But the bottom line is that we really owe it to ourselves, we owe it to our children, we owe it to our grandchildren to really not only take care of ourselves, but help take care of them as well. And we owe it to ourselves to take responsibility as well, to the extent that we can. And there are people out there, and I'm sure you found that in your survey too, that there are people out there who really want the best for themselves, the best for their children, the best for their families. Sometimes they have difficulties getting the best. Sometimes they have difficulties getting anything at all. But it doesn't stop them from trying. It doesn't stop them from putting forth the effort. And I think too many times people are condemned